Okay, this is a book review. The name of the book is The Mouth-Body Connection by Gerald Curatola. He's a dentist. If you want to see this guy, he's actually got some pretty good videos. Most of his videos, I've seen him on the YouTube channel called Real Truth About Health. Real Truth About Health. It's a decent channel. I mean, I think they promote omega-3s too much, but it's a decent channel. So anyways, he invented a toothpaste. The toothpaste he invented is called Revitin. I have never used it. And of course, he's going to promote it, but it does sound better than the regular toothpaste. I'm not even sure it's worthwhile to use any toothpaste. You definitely want to floss your teeth at night because when you go to bed at night, your saliva decreases, so you want your teeth clean before you go to bed. It might be best. Ruth Heidrich, PhD, the 40-year survivor of breast cancer, she would brush her teeth just with a toothbrush, but no toothpaste. And the reason to brush would be to remove some of the biofilms around your teeth to prevent them from accumulating and becoming plaque or tartar, so to speak. Let's see, what else? This when biofilm accumulates and gets thicker, it becomes called tartar and calculus. Biofilm is also called plaque. Bacteria live in it attached to the tooth, for example. He says the worst things for cavities, dietary simple sugars, and acidic things. That's pretty well known. Or anything that decreases saliva. A lot of medications have a side effect of decreasing saliva, so you should always ask about that if you ever have to take a medicine. Does it decrease saliva? Because that's a big problem for teeth. Let's see. If you get a cavity and it'll first break through, I'll show you pictures of all this. It'll first break through the enamel, then it can break through the dentin, get into the pulp space, and that could kill the tooth, and then you got to have other problems to get it treated. Let's see. Other things that'll decrease saliva is a rare disease like Sjogren's syndrome, an autoimmune disease. Gingivitis just means inflammation. Mildest form of periodontal disease is just inflammation of the gums around the tooth. I'll show you some more pictures of stuff now. So here's a tooth. Here's the enamel, also called the crown of the tooth. The layer just deep to that's called the dentin. It's got little tubules all the way throughout. Here's the gums called the gingiva. There's the gingival sulcus right in here. That's also called the periodontal. Peri means around, dental means tooth, so periodontal pocket. Normally, you shouldn't be able to stick a probe too deep into that. Okay, the jaw itself, the bone on the lower bone is called the mandible. The upper bone is called the maxilla. This is called alveolar bone. Alveolar kind of means like holes. There's little holes in it. The roots are these parts of the tooth that stick down, and then the arteries, veins, nerves all pass through this. This is called the tooth apex. Okay, so I'll show you what a cavity looks like. So here's an example of a cavity. So this cavity, it's broken through the enamel. Now it's breaking through the dentin. And then if it gets into the pulp space, it can sort of kill the pulp space and kill the tooth. It'll become a dead tooth. Okay, this is showing the little tubules in the dentin, and odontoblasts are bone-forming cells. Normally, blood flow comes in through the bottom of the apex, and it has a little bit of hydrostatic pressure to push fluid out through these dentin tubules, and that helps you prevent from getting a cavity. When you decrease blood flow because of atherosclerosis, as you get older, you increase the risk of getting cavities. And then things that suppress your immune system make it worse too, like being stressed out. Then if you're also eating, sweets and acidic foods, that's also bad. So here's a healthy, normal gingiva, and you can barely probe in there, not more than 3 millimeters. Periodontal ligament is like partly from the alveolar bone, partly from the tooth. It's intertwined fibers that grow out from each of these things to keep the tooth stuck to the bone. Okay, so here is gum disease. There's inflammation. It's red. It'll be a little puffy, swollen. The probe is going more than 3 millimeters deep. Okay, you can have bone loss too. When you have bone loss, I worry about infection. Here's the plaque buildup, and the bacteria live in there, and again, they can start eroding into the tooth. Now, I wanted to show you something kind of interesting. Briefly, he had a nice little summary of the protocol for removing dental amalgams because they contain 50% mercury. They're very toxic. So the ideal setup, and this is what's recommended by the IAOMT, the International Academy of Oral and Medical Toxicology, is to have a nasal hood so the patient's breathing oxygen into their nose. You have an air filtration system to suck out the air right away, so nobody wants to inhale mercury vapor because it's toxic. They're wearing these gas masks so they don't inhale the mercury vapor. I'll show you another picture of it a little further into the procedure. So here is, the dentist. He's got a drill that he can cut little pieces of amalgam out and remove one piece at a time, it's called a chunk removal technique. And here's the dental assistants holding a strong suction device to suck out the mercury vapor and suck out whatever fluid or amalgam pieces can be removed to prevent the patient from swallowing them. On the next page, I'll show you a little more detail about the amalgam removal protocol. The patient takes activated charcoal before the procedure because it'll bind small particles of swallowed mercury and allowing them to exit the body by defecation. We talked about the outfiltration system, powerful suction. They'll also inject water around the area where the dentist is working with his tools, like let's say if he's using a drill or anything, to cool the tooth so you don't get heated, more vapor being released. He uses a rubber dam also to isolate the tooth that's being worked on. The mouth is vacuumed thoroughly afterwards. The patient rinses and spits out whatever can afterwards. All these things to prevent, heavy mercury exposure during the removal process. And, a dentist, that you go to, I would only go to one that has a lot of experience doing this. If you're going to get any dental amalgam removed, or if you're going to get a root canal removed, you can just go to the IAOMT.org site, and then you can search for a dentist in your area who's been trained in that. Most of them have not. So I would only go to one that's trained in that if you're going to get an amalgam removed or get a root canal removed. Okay, I hope you found that helpful.